I am Dr. Abhishek Chakrabarti, consultant nephrologist. I have done my DM nephrology from SSKM, Kolkata, and passed in 2019. So I have been practicing ever since then. Today, I am here to discuss something about pedal edema, or to put it in more simpler words, it is swelling of feet. Swelling of feet is a very common problem that can affect any person of any age, but is more commonly found in the older age groups. For example, age above 50 years or more. It is common in both males and females, and it is slightly more common in persons who are overweight rather than the persons who are of average weight or who are thin built. But pedal edema, that is swelling of feet, when it occurs for the first time, it is quite natural that a person can notice it, particularly in the evening when he or she returns from his or her daily work. And it can be quite some troublesome because the person will find difficulty in wearing or getting rid of their footwears. Maybe they will notice the swelling of feet for the first time in their life during the removing or wearing their footwears. And after that, they will obviously get tensed and seek medical attention. At least this is common for most of the cases. So I am here to enlighten about the common causes which can result in pedal swelling and whether to worry about it much or not. Firstly, we need to notice whether the swelling occurs in one or both feet. Swelling commonly arises from the forefeet, then it progresses above the ankles, and then in the lower legs, and finally above the knees. Usually, most common swellings are brought to medical attention when it has appeared near or just above the ankles. If only one foot is affected, that is the swelling is unilateral, then the causes are somewhat different from what we must think when the swelling affects both the limbs, that is the swelling is bilateral. I will first discuss about the bilateral swelling because these causes are more dangerous for the general health. Swelling of feet, that is pedal swelling, can occur due to various systemic illnesses. That is, the illness may lie in certain organs. Functioning of certain organs may be hampered, for which the excess fluid gets accumulated in the feet. Excess fluid, why it accumulates in the feet and not in any part else? Because of the obvious reason that the feet is the most dependent portion of our body. Usually, when we tend to sit or walk, the feet tends to lie at a lower down position, and the effect of gravity ensures that a significant portion of body fluid gets collected in the distal extremities, that is in the forefeet, ankles, lower legs, and so on. So, swelling of feet is more common when excess fluid gets accumulated in our body, and that occurs when in diseases of the kidneys, liver, and heart. These are the three main important organs of our body which, when gets dysfunctional, causes accumulation of excess fluid in our body. Coming about the heart is undoubtedly the most important organ of our body, because if it stops only even for about just a second, then also a person can die. The condition in which excess fluid gets accumulated in our body due to cardiac dysfunction is called congestive cardiac failure. Congestive cardiac failure means the heart is unable to pump the blood as according to the needs of the various organs or systems of our body. But as a result, excess blood tends to accumulate in the distal extremities, resulting in pedal edema or swelling of the feet. Congestive heart failure may commonly occur in persons with certain ischemic heart diseases. What are ischemic heart diseases? They are the heart diseases in which the blood supply to the muscles of the heart get compromised to certain extent, resulting in inability of those muscles to act properly during pumping of the heart. These are very common diseases which need medical attention as early as possible, because the symptoms can be very much debilitating for the patients and can cause a lot of morbidity as well as mortality. What we need to observe in patients with cardiac dysfunction who have pedal swelling, we need to observe certain things like shortness of breath on exertion. The exertion may be the severe exertion, which is quite unlikely, maybe moderate exertion or mild exertion, or even at rest. And another thing which the patient might notice that he or she has the breathing difficulty after sleeping for a certain duration, say 1 to 1.5 to 2 hours or so. The sleep gets started quite smoothly, but after that it gets disrupted due to respiratory distress, that is shortness of breath. And then the person gets up, takes the coughs out. So there may be certain expectoration also at that time. And what may the other thing, he or she takes few long breaths and the shortness of breath gets relieved. It is just because the effect of gravity, which has kept the excess fluid confined to the distal extremities when the person is sitting or standing, is obliterated when the person is in a recumbent, that is lying down position. As a result, the excess fluid travels upwards and gets accumulated in the lungs, that is in the pulmonary vasculature, and as a result, the person gets shortness of breath. There are other factors also which might cause cardiac diseases, but I won't discuss them in details here because this is not the right place, I think. Then diseases of the liver. Diseases of the liver may not be that common, but still when this occurs, there may be certain problems. What problem? Usually this disease of the liver tends to present with abdominal swelling rather than pedal swelling. There are various causes because of which abdominal swelling is predominant in these patients. But liver is the region, it's the organ of the body which synthesizes an important protein called albumin. What this albumin does, this albumin makes sure that our excess fluids stays within the blood vessels. Here I would like to mention that our body contains a lot of amount of water. Water constitutes about 60% of the body weight, of the dry weight of a person, of an adult male person, and about 50% in an adult female person. So it is very important, but only about 5% or so of this total body water stays within the vasculature, that is within the blood vessels at any point of time in a healthy person. It may be more also, but it is not that more also. For example, if a person weighs about 70 or 80 kgs, he or she will have a significant portion, say about the 35 to 50 kgs of water in his or her body, but out of that only 5 kg or maximum 6 kg can stay within the vasculature. The vasculature can at best accumulate about 10 to 12 kgs, not more than that. So what is the factor that keeps this water inside the blood vessels? It is this albumin. When the liver gets dysfunctional, albumin synthesis gets impaired, for which the blood, the excess, the fluids get accumulated in our body, because this the fluids get tends to extravasate from the blood vessels into the body cavities, and in that case we get not only abdominal swelling but also pedal swelling. How common is that? It occurs in a condition which is commonly caused end stage liver disease or chronic liver disease, which is most commonly caused by liver damage as a result of chronic alcohol abuse. May also occur in the other conditions like a sequelae of chronic viral hepatitis, or in patients with long-standing diabetes mellitus, hypothyroidism, and other diseases. Then coming to diseases of the kidneys, we all know that kidneys are very important to maintain our fluid and electrolyte balance. What our kidney does, what our kidneys do, they filter out the waste products of our body. But here we should remember that the largest amount of the waste product that the kidneys filter out is water, because our urine contains maximum quantity of water apart from other substances. So quite naturally, when the kidneys fail to excrete excess water, then it has to be accumulated in our body, and that results in pedal swelling. Another thing I should like to mention here, that a particular, so there are certain diseases of the kidneys in which albumin, which I was mentioning just a time earlier, albumin gets excreted into the urine, resulting in low serum albumin, and in that case also excess fluids get accumulated in our body. These conditions, known as nephrotic syndrome, also presents to our clinics as pedal swelling, or more commonly swelling of the groin region, as well as periorbital puffiness or frank facial swelling. So these diseases of the liver, kidneys, and heart, pedal swelling is a very important clinical finding. What are the other causes? They are the other important causes. I must highlight two benign causes here, because they do not represent any systemic illness. One is in the elderly obese persons, there occurs pedal swelling, particularly if the person tends to sit keeping their legs downwards or tend to stand for long durations. This condition itself is not that harmful, but the person must keep in mind that if he or she doesn't try to reduce his or her weight, then they will invite a lot of other dangerous conditions that will result in further mortality and morbidity. And another thing is, any person, particularly elderly persons, if he or she has to sit or stand for long durations in the same position, then he or she will also develop pedal swelling, which itself is not that deleterious. But there are other conditions which we must keep in mind. Firstly, the important metabolic condition is hypothyroidism. Hypothyroidism causes a type of swelling of feet that is quite hard in consistency. If you press the swelling above the ankles, then there may be no or slight dimpling compared to soft swellings. Hypothyroidism, the swellings usually tend to become permanent over time if not addressed at the right point of time. That is, if the hypothyroidism is not addressed promptly, then the swelling will tend to become lifelong. Other thing which can cause the both, but by the unilateral as well as bilateral swelling is diseases of the lymphatic systems and chronic venous insufficiency. There are multiple lymphatic channels in our lower limb, so there are also multiple veins also in the lower limb. If they fail to perform their activities properly, which commonly occurs in elderly persons or in persons in whom there has occurred certain malignancies of which has caused enlargement of the lymph nodes in a particular region of the body, then the drainage will become improper, resulting in pedal swelling. Venous insufficiency, usually it is not a cause of concern, because these persons usually do not develop problems unless they tend to neglect their swelling for long duration. But the lymphatic swellings, particularly those associated with malignancies, must be addressed promptly. And here I would like to mention the age-old disease called filariasis, which presents as either elephantiasis. That presented as elephantiasis in past, because nowadays it is not that much common. It usually presented with massive swelling of one or both lower limbs. Usually it was unilateral, bilateral was much less commoner. Now, swellings of only one limb, the common causes are firstly any infection of affecting the skin, soft tissues, or even the serious infections that can affect the tissues up to the bones may result in unilateral pedal swelling. These are very dangerous conditions. They have to be treated promptly, or the infection will spread throughout the whole body and the treatment will be much more difficult. Then another very important condition, quite a dangerous condition, is venous thrombosis. What it is, if a blood clot gets impacted in a vein, in the large vein, then there will be the impairment of the blood flow to the vein, and that will result in swelling of one or swelling of the affected limb. It is quite common in the femoral veins, which are the largest veins in the lower extremities. Thrombosis is the defective formation of blood clot. That is, the blood clot is formed there only. It can occur in various conditions, and is particularly common in those persons who have to stay, whose mobility has been restricted because of various reasons. Also, it is quite common in persons having central venous catheter in the femoral veins. It is quite a dangerous condition, because if the portion of the blood clot breaks down and is transported through the vein into the heart or the pulmonary capillaries, it will be the life-threatening to the patient. So these are the quite dangerous causes, but thankfully they are not that common. Another thing I must mention here, that a pregnancy-related condition exists in which swelling of feet is very common. Swelling of feet can occur in the mild form in any pregnancy, particularly in the later stages, what we call third trimester, that is after 28 weeks of gestation. But if the swelling is quite significant and the person has high blood pressure also, then there is every reason to suspect that the person has preeclampsia, and if not addressed properly, can lead to convulsions in any time of the pregnancy period, and it is life-threatening to both the person and the unborn baby. This preeclampsia needs to be addressed as early as possible. The blood pressure needs to be controlled. That is the major condition there which needs to be treated here. And last but not the least, though not very common nowadays, it was quite common in the period in which there were widespread famines and unavailability of food. It was chronic malnutrition. Chronic malnutrition leads to not only deficiency of albumin, but also a form of liver dysfunction that results in body swelling. And the feet definitely won't be unaffected in this condition. Also, thankfully, nowadays, our country is self-sufficient in food grains, and so we do not usually find this malnutrition. Malnutrition alone, if there are no other comorbidities. So I think I have covered most, if not all, the conditions leading to pedal swelling, that is swelling of both feet or any one foot. And accordingly, I think that the listeners will take home certain messages, like if the swelling of the feet is persistent and is not resolved by keeping the legs in the upward position while resting, and if there are comorbid conditions like diabetes or hypertension or hypothyroidism or chronic heart diseases, liver diseases, kidney diseases, then it is best that the person should seek medical attention as early as possible. I would just like to add one thing, that in particular groups of antihypertensive medicines can also cause swelling of feet, which is not dangerous. I think if you have hypertension and develop swelling of feet, then it is best to consult your doctor about what is the probable cause of your feet swelling, rather than changing your antihypertensive medicine or keeping or withholding your antihypertensive medicine for 1 day or more, because single dose of antihypertensive single missed dose of antihypertensives can lead to catastrophic consequences. Your doctor is the best judge, and so please consult your doctor as early as possible. If you have any worrying problems, particularly regarding swelling of feet. With this, I would like to end my session. Thank you all for your patient hearing.